This is a pretty classic example of a patient that has cervical stenosis. And what's interesting about this case is some of the symptoms, some of the earlier symptoms. She's had neck pain for a long time from her arthritis. And the arthritis really isn't what we're trying to fix here. What's happening is she's starting to lose function in her hands, and she's starting to get symptoms related to pressure and damage to the spinal cord. Notably, she's having significant burning, numbness, tingling in the hands, burning down the arms. And she was told she has carpal tunnel, but the numbness and the tingling is on the pinky side of the hand. Carpal tunnel is always on the side of the thumb and the index finger. It could include some of the other fingers, but carpal tunnel is never on this side of the hand. There are other nerve compression syndromes that can be that, but it's not carpal tunnel. So she's experiencing numbness, tingling. She's also experiencing where the muscles, the wasting of the muscles between the fingers are disappearing. So her hand almost looks skeletonized. You can see the bones through the tissue as opposed to seeing plump, soft tissue. So she's having wasting, which is a sign of nerve damage. So pain in the back of the neck, cramping, aching in the back of the neck, tingling in the arms, burning, atrophy in the hands, weakness in the grip strength, changes in dexterity, things like that are really important. She also doesn't really notice that much that her balance is off, but when she walks and she changes direction, she'll kind of do this sort of a thing. That's a sign that your balance is off. Walking up steps and having to hold on. Things like that are early signs that your spinal cord is starting to malfunction. So cervical stenosis that you can clearly see here, and again, stenosis means that the normal spinal canal is severely compressed. Multiple levels where the cord, below there is good, above there is good. All of this area in between, the spinal cord is severely compressed. And again, this is a good example of what patients experience. And this isn't a kind of a middle phase case. This patient already has significant symptoms, significant atrophy, significant balance and dexterity issues, significant burn, numbness, and tingling. So it's a little bit late. Conservative treatment, once you're at this point, it's really not useful. It's going to get worse. It should be fixed. And there's good data that shows that cervical stenosis that's symptomatic is better treated in healthy patients that are untreated, particularly in young, healthy patients. So if you're in your 50s or 60s and you have cervical stenosis and you're starting to have wasting, you can't do things, this is something that's very manageable.